Hello everyone, and thank you for attending today's Project Improve webinar. Before we begin, we'd like to cover a few housekeeping items. At the bottom of your audience console are multiple application widgets you can use. You can expand each widget by clicking on the Maximize icon at the top right of the widget panel or by dragging the bottom right corner of the widget panel. This webinar is being recorded, and the recording will be available one day after the webinar using the same audience link used for this webcast. A copy of today's slide deck is available in the Resource List widget. It's a green folder at the bottom of your screen. If you have any questions for presenters during the webcast, you can click on the Q&A widget at the bottom and submit your questions. We will try to address as many questions as possible during the event. But if a fuller answer is required or we run out of time, we do capture all questions. If you have technical difficulties, please click on the Help widget. It has a question mark icon and covers common technical issues. Now I'd like to pass it over to Scott Bumgardner. Scott, you now have the floor.
Hello, everybody. I'm the Deputy Project Director for Project Improve, and on behalf of the Project Improve team, welcome and thank you for joining today. You'll hear from me again at the end of today's webinar when I'll moderate our Q&A, but now I'd like to turn it over to Carol Mizuguchi, our OFA Project Officer. Carol?
Thank you, Scott. Good afternoon. My name is Carol Mizuguchi at the Office of Family Assistance, and I would like to thank you for joining today's webinar, Project Improve, how the LI squared process can help your TANF program improve outcomes for low-income families. We are very pleased to have this opportunity to present this project to you today. Project Improve is an evidence-informed approach to program improvement. So it's learn, innovate, and improve. The project provides training and technical assistance to a select group of TANF agencies on improving their program outcomes by infusing components of rapid cycle evaluation and utilizing the learn, innovate, improve strategy for managing collaborative, evidence-informed program change. The technical assistance enhances the ability of TANF programs to make and sustain program improvements. Mathematica Policy Research developed this approach in partnership with the Center on the Developing Child at Harvard University, with support from the Administration for Children and Families, Office of Planning, Research, and Evaluation. This project has been or is being used in a dozen of TANF and workforce agencies across the country to design, implement, and test innovative strategies to improve program performance and client outcomes. So today's webinar, the learning objectives are, one, to provide an overview of the LI squared process, and also we will highlight innovations that have emerged from the TANF programs using the process. And finally, you'll learn how this process might be a helpful approach to you and your program. So again, thank you very much for joining us. And at this point, I will turn it over to Michelle Dare from Mathematica.
Thank you, Carol. My name is Michelle Dare, and I'm from Mathematica. I'm a senior researcher here, and I'm the project director for Project Improve. And it's great to be here and share with you something I'm very passionate about, and that's the LI squared process. But before we get started, I just wanted to stop and thank Carol for her leadership as the project. She and Damon Waters both as co-project officers. And then also Lisa Washington Thomas, of course, for her insight and guidance. And as well as some of the central office and the regional staff. I see my friend Eileen Friedman, Frank, Gary, Tom, others on the call. And just want to acknowledge their hard work and efforts in really helping TANF programs across the nation improve their outcomes. Just wanted to acknowledge them. And so also just, this has been a joint collaborative process in this whole development of the LI squared process. So keep that in mind as we go through, and I'll share how that's come about throughout this time. So just, you'll see on your slide the roadmap for the webinar. What I'm going to do is provide an overview of the LI2 process and give you a little bit of background and context. And then I'm going to share 3 examples of how we've used LI2 to help develop promising interventions for the field and what that's meant. And then I'm going to turn it over to Dina Jardine and Noelle Simmons. Dina is from Larimer County, which is Fort Collins, Colorado, and Noelle is from San Francisco, the Human Services, I'm going to goof this, Human Resource Administration, Human Services Agency. I have so many acronyms across the country in my head. I apologize for that. The San Francisco Human Services Agency, and she's the Deputy Director of Economic Support and Self-Sufficiency Programs. And Noelle and Dina have been working closely with us on an ongoing basis using this LI2 process. And the reason why I pulled them into this is because these are people who are using it. It's a good process, but it's not an easy process all the time. So really, these guys are both very thoughtful administrators who will be honest about their process. They're not just going to be cheerleaders. They're going to give you the benefits and the challenges of both using this process in terms of bringing about program change. And I trust that they will be, and I know that they will be both be honest and also and insightful and answer some of the questions that you might have as an administrator, as a staff person about this process itself. So that's why I recruited them, and they're both super smart and again, insightful. So just quickly, we want to do a polling question to keep you guys awake. To just gather your feedback. I'm just kidding. The first polling question is, to what extent do you use research and evidence to make decisions about how to improve services for populations you serve? So to what extent do you use research and evidence to make decisions about how to improve services for the populations you serve? For the polling question, you can indicate never, rarely, often, or almost always. So I'm going to pause just for a few seconds and let you answer that. All right, I will move on now. So the next slide. Oh, often. So that was good. 71% said often, 71.4%, and 28.6% said almost always. So we may have some selection bias on the call, but I'm thinking not. So we'll go with that. As a researcher, that warms my heart. So why the LI2 process? And we'll go down through the list, but really where this came about, and Carol mentioned it a little bit, was a dissatisfaction with the status quo, saying we could do this better, we can do programming better, and really thinking through, is there a way to help improve program outcomes and strategies that we can implement that are different? And so my former colleague and partner in crime, Donna Pavetti, and I really started down that road and said, can we help programs improve? And so we went down, and I'll share some of the examples that we came up with and that are in the works later in the presentation. But separate from that, so one was about getting good interventions, but separate from that, we knew that in order to get good interventions, we had to change the process for providing technical assistance and working with sites. So it wasn't just about creating new and innovative, promising practices that are science-informed, but it was also about how we worked with sites that mattered. And so we partnered and we adapted in partnership with Harvard Center on the Developing Child, their translational science model, as Carol mentioned. And we also worked under a project called Project Awesomer that was sponsored by Office of Planning, Research, and Evaluation. Our project officers hopefully are on this call. But there really was more development as part of that project. Both were equal partners in this, along now with OFA, who has joined the group of us. But more importantly, before we go down, why LI2, the approach that we used in doing this was to work in partnership with the field to create a process and a set of interventions in collaboration with the field. And so you're going to hear that in both Noelle and Dina's presentations, that this really is a collaborative process in working. So all that was to say, let me go to the slide and read the slide. Why LI squared? We were really, again, there was just this disconnect between research and practice, and we wanted to bridge those together and say, could we bring about change in a more analytic way? There were also fewer program resources and higher expectations. You all have lived this in this notion of having to make good decisions and making sure that your investments in programs have a payoff for them. And being able to make decisions with precision based on feedback about what's working and for whom, and being able to make quick changes at a low cost before you're fully invested in, before you scale up. And then this other kind of notion of, again, and this is tied into this need to increase program capacity to make evidence-informed decisions. So the LI squared process is not about somebody like Mathematica or other research firms, coming out and telling you what to do or doing it for you. It's really a collaborative process for making that change and an appetite for evidence-informed decision-making. So next slide, what is LI squared? It's really a three-stage process: learn, innovate, improve. This was vetted by the field, created in co-creation with the field. The language itself, it was a long story on how to get there, but we really did make sure we used language and processes that resonated for people. And what LI squared is it's a change management process that really embeds in analytic techniques for improving program or desired outcomes. So you'll notice that circular, that the graphic itself, the learn, innovate, improve, you have multiple on-ramps, multiple off-ramps. So you can start with the improve stage if that's where you're at. You can start or exit at different places along the process itself. Next slide. So the key features of LI squared, again, this close collaboration between the TA team and program staff. It's a co-creative process. We work with both the administrative team and also direct service staff, sometimes separately and then sometimes together in very strategic ways. There's strong evidence in analytic approaches at every stage, and then there's this capacity building to really institutionalize and change the culture around change. I should also mention, one of the things that we did was, in terms of bringing on both Noelle and Dina, and this is important to note, that Noelle has a pretty strong research shop, and she's got good, thoughtful people that can help with that research angle of this and in supporting her. But Dina doesn't have anybody. She does not have a research shop. She does not have this the kind of resources, and yet both programs are using it in equally powerful ways. And that's the piece that I think is really important to distinguish. Whether you're a small rural community or whether you're a large resource city with resources, you can use this process. So let me go through each of the stages. So the objective, the learn stage, it's just as it sounds. The whole goal of the learn stage is to really understand and assess the program environment and really clarify the reasons for making that program change. And really defining what is it that we want to be different and having discipline around that change process. And what we do is oftentimes we'll do a simple implementation assessment and really talking with staff at all different levels to understand what it is that they want to change and why they want to change it, and what would be required within the program environment to change, what would need to be required in order to make that change stick. And that's a really important point, because it's not just about throwing out an intervention, it's about integrating it into the existing program environment so that it's streamlined and it doesn't create noise for staff. So that's the learn stage, is really understanding, defining the problem. The second stage is the innovate stage. This stage is really challenging. It's also very fun. It's getting disciplined about what is it that you want to ultimately achieve. What is it that you are targeting for change? In other words, what would need to change within clients, within staff, within administrators, within culture in order for that change to occur? And then what strategies will lead to that change in behavior, attitudes, beliefs among your targets? And all this is to say that it's getting really disciplined about the link between what it is you're doing, what it is that you will hope will change as a result of what you're doing, and what is the desired outcome, both short and long-term outcome, that will happen. I can't tell you how many times I go into a program and they have a very aspirational outcome, but that it doesn't necessarily align with what it is that they're doing. I always use this kind of jokingly, is that they say we want families to be, long-term self-sufficiency, and yet what they're offering is 6 weeks of independent job search. The reality is if you have the resources to do 6 weeks of independent job search, then make sure your outcomes align with what you hope to achieve. And are there other ways that you could tweak your program, if that's all you have the resources for, that could lead to better outcomes within the constraints that you have? So this product of the innovate stage is what we call a roadmap for change, and that's that alignment. And it really is thinking about how do I apply the science or other kind of techniques, and I'll share with you examples of that to help inspire your thinking. The tips for the innovate stage, it really does require the time to think, the space to try, the safety to fail. And again, drawing upon the best available evidence, research evidence to help inform, to inspire that change, and also practice wisdom. Where we don't have a large evidence base, it's drawing in practice wisdom to help inform that. And then it's also getting the right mix of people in the room. And I want to just give an example from our work with Noel in San Francisco. Really, one of the change processes we went through after when we came back out, we met with top-level administrators in the morning, direct service staff in the afternoon, then back to top-level administrators, and then back to direct service staff. That I use moving forward all the time, because what it taught us was we went back and forth between the field and the top-level staff, and both of these administrators on this call, both Dina and Noel, are really good about that top-down, bottom-up approach. And that led to the right mix of people in the room to help inform change that everybody is bought into and invested in helping to make that change occur. So this is a good example of getting the right people in the room and doing it in efficient, strategic ways so that they help and play off of each other. Next slide. So the improve stage. This is where once you've figured out what it is that you want to try out, and you've mapped out and said, this is what we think will happen as a result of it, let's try it out. And let's try it out in a small scale and figure out with a small number of staff before we invest in a full scale up. And so it's really a kind of what we call a road test. It's trying it out, it's working out the bugs, and doing multiple learning cycles within a road test to be able to get it right before fully investing in a full scale up. So next slide. A typical road test, as I mentioned, subset of frontline staff, few clients per staff. We've done it few clients per staff, and now we're doing what's called, we've iterated off of that. We typically use a few clients per staff, but in Project 500 in San Francisco, we're actually doing a boot camp where we're saying do it with everybody in a 2-week period and let's see what happens, and gathering information more frequently. So you can iterate off it. There's no set way to do this. It just depends on what the program needs. You're selecting the strategies for the innovation or the targeted change, and then you're getting feedback, targeted feedback about the implementation. So next slide. This is just an example, keep going through, from Ramsey County, Minnesota, my friends there, and we've done a lot of road testing there and a lot of this process using LI2. They rolled out a coaching intervention where it was 4 weeks of, we split the different staff. They had a total of roughly 25 staff. I'm not doing the math correctly on that. 32 staff, I think that's right. And we split them up into 3 cohorts. And what we did was we did one cohort with the first iteration. We gathered information from them, and then we refined it, and then we did a second cohort and then a third cohort. And when I say gathering information, if you remember, I travel a lot for work. And oftentimes when I travel, an airline will send me a quick link that says, can you fill out this customer satisfaction survey? And so we've incorporated that approach, and we've done it in multiple different ways, but really you can use just a simple click on this link and provide feedback. You can gather feedback from clients. You can gather feedback from staff who are using tools or using the approach. And then you can also gather feedback from other sources. You can actually use actual user data, as in the case in Fort Collins and Dina's team with some of the work that we've done there. So there's lots of ways, but the whole point is to establish your learning objectives at the first of that innovate stage. It's to figure out and design something that's low burden, a road test that's low burden, that will give you the answers to the kinds of questions that you're wanting to know, and then figuring out how long will we do this road test, and then how will we get the information. So typically at the end of one of those kind of cohorts, we would gather the information and then come back to the site. And we, in the case of both of these programs, both P500 and some of the work in Larimer County, we go back to the staff and we go back to the administrators with the finding from that road test. And we share it just in a simple webinar, and then they can make informed decisions about how to adjust. And then we roll that out again, and then we bring the information or feedback back to them. And all this happens within a very short period of time. It's usually a 2-week turnaround in between learning cycles, so that we're quickly going through, working out the bugs, establishing, refining until we're ready. We think we've got it. Now we're going to go with this permanently, or scale this up, I should say. So there's a level of precision in program change that occurs through that. So that was a lot of information, and I could share a lot more. I do whole workshops on this that last a whole lot longer than the 20 minutes I just shared with you. But I'm going to share with you a couple of examples of how we've used LI2. And one is using existing evidence-informed processes or practices, and then that have been tested and found to be effective, have impacts with other populations, and how we adapted that. There's another way of doing it where we've actually designed a new intervention. And then the third way we've used it is working with groups of sites in a learning community to create innovation around a problem they want to solve. So I will quickly go through those, and then I'll kick it over to Dina. So next slide. We've got a polling question before that, though, that I need to stop for. So the polling question is, what challenges are the highest priority for you? I just lost that slide. Is it coming? Yeah. Okay, it is coming. Maybe you've seen it. What challenges are the highest priority for you to address in your program environment? So what are you most concerned about in your program environment that you'd like to address? So I'm just going to pause for a few minutes, a few seconds, and allow you to go ahead and fill that in. All right, let's go to the next part. So as I mentioned, I was going to share with you some concrete examples for using the LI2, where we've used the LI2 process. The first one is in taking an evidence-informed practice. This is the example of WOOP. WOOP stands for Wish, Outcome, Obstacle, Plan. There's 20 years of research showing success with helping where people are using WOOP. The technical scientific name is mental contrasting with implementation intentions. It was created by a researcher at NYU named Gabrielle Oettingen. And through her work, she actually started as a HOPE researcher, and through long path to get there, she landed on this process called WOOP. It's an active process for fully engaging in life, and it really does help a person explore their wishes, their outcomes, their obstacles, and plans without judgment. Next slide. WOOP is, there's an app, www.woopmylife.org. We came across WOOP, Donna Pavetti actually came across it at a meeting, Frontiers of Innovation at a Harvard group, and heard Gabrielle speak and said, I think we could use this in TANF programs to help people get unstuck. For families who are not progressing, for families who are unclear about what it is that they want to do, let's try it out. So we recruited, next slide. We recruited 3 communities. We were working with Larimer County on other things, and so we pulled them in, and we knew that they were good partners. We also pulled in a smaller community in Lynn County, Oregon, and then a nonprofit agency, JEVS, in Philadelphia. And we basically went out and did site visits to see how we could possibly take WOOP and adapt it. This is the short version of a very longer story. We did a roadmap for change in each of the sites that were specific to a TANF setting. Again, this was an intervention we knew worked, but we didn't know how to get it to work in TANF agencies. And so we were rolling it out and used the LI2 process for that. We've done 2 rounds of road tests in each of the sites, and originally what our plan was to roll it out, train staff to roll it out with clients. But through the road test, what we found was that it was too difficult to start just with staff in training staff to train clients on how to use WOOP, that what we needed to do, and we would be more effective at, is to train staff to use it for themselves first, and to really get good at it and using it and become believers in the process, and then they could share that with clients. We also found that WOOP wasn't for everyone. And so offering the opportunity to do it is what we wanted to do. So through that road test, we learned several things about how WOOP could be used, where we needed to roll it out, and we're now working with Harvard Center on the Developing Child under another grant, and we're going to develop tools under WOOP that will be available to TANF programs nationwide. So look for that. That's going to be coming out, and we'll share when that's out. Those resources are out, and that will be available to all TANF staff, again, throughout the country. And that was through, again, the LI2 process that we did that. The second intervention, executive function informed goal achievement. This one has been a 3-year endeavor and included a whole host of sites, including the 2 that are on the phone here. What we learned, next slide, is there was a dissatisfaction, again, that I mentioned at the beginning of the call, that there was room for improvement. How did we get TANF programs to move the needle in terms of outcomes in serving low-income individuals and families? There was also this new science that was emerging on the impact of poverty on adult success, and this notion of bandwidth tax and other kinds of sciences. And we said, how could we incorporate this new science around, and also around self-regulation more broadly, in helping workers interact with clients in a totally different way? And by the way, how do we do this in the current regulatory environment with no new resources? So that was part of our challenge in setting out with this piece. We had the science, we had willing sites, again, including the 2 that are on the phone, and we had a process for working with sites to figure out how to make this, how to get it to work. Instead of it doesn't work, yes, no, how do we get this process to work? So let me boil down the science for you really quickly so you have a little bit of context. Next slide. So what we found was, and this is central to the model in which we've created, and there's more to this whole story. I could do just a webinar on this, and happy to do it at some other time. And please reach out if you have any questions on any of this stuff. But what we found is that how you set a goal matters. That in setting a goal, you really have to find out what is important to the person. If a staff person sets a goal for a client that they're not bought into, they're more likely to disengage. And particularly, and we see that happen all the time. They're not invested in it, they don't care about it. So what we found from the research is that you have to get something that that they truly care about, and then stopping and pausing and imagining what would it feel like if they accomplished their goal was also incredibly important. That visualization of the process helps them to understand and internalize the why. And it hooks into their, physiologically, subconsciously, it hooks into their motivation. We also know and learned that having a detailed plan for how to get from here to there was incredibly important. And mapping that out in specific small steps is critical to success. We sometimes assume that people know how to get there, and it's really breaking it down into achievable steps that matters. And as part of that plan also, it's figuring out what are the potholes and the detours for getting it. We don't talk about assessments anymore in our world. What we talk about is goals, and we talk about, instead of barriers to work, what are the potential potholes that could interfere with you accomplishing the goal that you really care about? And what is it that you could do to sidestep that if that happens? So it's figuring out what's the plan for addressing that pothole before you ever encounter it. The do is putting that plan into action, and then we also know that reviewing and revising goals, reflecting and using that reflection piece as a way to learn, and it's not a judgment about what could work and what worked and what didn't. It's more of a non-judgmental assessment of what can I do moving forward. So in some ways, under this kind of approach, it's that if you didn't accomplish the goal, it's not seen as a failure. It's seen as information for you to set. It was the wrong goal for you. It was not, there's opportunities to map out a better plan. And so it's really used as a way to help improve that process. So what we did was, and there's a longer story again to all of this, but these are the things that we're testing out. Next slide, using the LI2 process in working with sites. And there's a whole host of information I could share around how the LI2 was used throughout this. We're doing road tests in 4 counties right now. But what we came up with is a service delivery process that's also built on this model. So it's this kind of go learn, go plan, the family in the middle, and go review with tools on the side. So it's just a high-level example, and I'm not going to go into the detail around this, of taking existing science and trying to create promising interventions using this LI2 process for getting there. And it's a disciplined process in doing that. Next slide. So I have another poll question going that's going to load in just a minute. It gives me a chance to break for a second, and it is, what are some potential roadblocks that could get in your way of implementing a new strategy or implementing a new strategy to address your priority challenge or challenges? So what are some potential roadblocks that you face? I'll pause for just 2 seconds. All right. So now I'm going to go on to just briefly share the third part of this, and I know Dina will pick up this. She was involved in this. This is a third way in which, and there's multiple ways. I'm just giving you examples, concrete examples of how we've used LI2 in really trying to bring about program change and innovation in a way that inspires the field and has a co-creative process between the research and practice communities. And the third example is from the Colorado Works Innovation Initiative. This was, next slide, a partnership between the Colorado Department of Human Services and Mathematica. We had 19 counties. We did a call for innovation, and we said, the problem that we want to solve is we want to increase engagement. And we left it more broad. We just said increasing engagement. We had 19 counties answer that call to say we want to innovate around increasing engagement. We worked for almost about 9 months with these teams that came forward, and we did this LI2 process. And we did a whole host of things to support their process. You can see it and read it on the slide of supports. And they really kind of supported and energized and inspired each other in this process. It culminated in a final event. We had it was modeled after a research conference. We had panels, we had presentations, we had poster sessions, and I have to say I've been to a lot of research conferences over my 20 years experience of being a researcher, and that was by far the most still research-oriented, and by far the most interesting, innovative, and engaging culmination of kind of convening that I've been to. It was very fun. So the next slide. I'm just going to share with you, these were some of the select innovations that they came up with. I want to just share with you two in particular. And they were all great, I have to say. But this is the kind of innovation that we're talking about. In Plata, which is Durango, Colorado, a rural community, what they decided to do was they wanted to get more engagement with TANF clients, do a deeper engagement with TANF clients, but they also had problems accessing services. So instead of home visits, what they did was road visits. They actually drove customers. They used the time that they would do assessments and drove customers to access and sign up for services that they didn't have access to. And so they literally did these road meetings and drove in the car and did the assessment, took the time that they would do assessment, driving people to get signed up for WIC, driving people to get their driver's license to get renewed, driving people, and they just did, it wasn't on an ongoing basis, but quick conversations. And what they found was the richness of the conversation, they really appreciated the richness of the conversations and the connections, and it took just the same amount of time as they would have done for a traditional assessment. There's more to that. We're still going to explore that. They're going to actually be in some of our other research projects under the federal government. But they did a lot of work to address the liability issue, but super interesting way and richer conversations that they had. The second one was Pueblo. They actually led to a set of resources that are available to anybody on this call around, they wanted to increase staff engagement. They found that they couldn't engage clients better because their staff were having some problems just feeling engaged in the program themselves. They were feeling super burned out. So long story short, we ended up doing a mindfulness intervention that they are using, and we've developed some tools, again, that are available to anyone. You're welcome to email me on that, and it was incredibly powerful. But that was their innovation, is how do we reduce the stress of staff to better engage staff that then could then improve engagement with clients. So next slide and final slide for me, and then I'll kick it over to Dina, and that is this notion of what happened with that innovation initiative. Well, we've got about 9 sites that we're continuing on with. That ended last June. We're still actively involved, and a subset of those sites are actually included in both federal projects, state projects, as well as some local projects that spun off of it. Dina was out on the road, and it continues to be out on the road, sharing at national conferences, and others are also presenting. There was a buzz, and we actually have heard that the 2Gen folks reached out to us and said, can you do a 2Gen innovation initiative in Colorado as well? So we're working with them to figure out how to do that. So again, another example of using the LI2 process to innovate and support innovation in a more learning collaborative approach. So I've talked a lot, and I'm going to pause there, stop there, and kick it over to Dina Jardine in Larimer County.
Thanks, Michelle. I'm here to share with the audience our experience of working with Mathematica to strengthen the testing, implementation, and integration of program changes. Next slide, please. I think it's important to understand the context in which we exist. We are a medium-sized county in northern Colorado. We have about 333,000 residents. We are on actually the Colorado Department of Labor side of the ship. We contract locally with our Department of Human Services to do the employment-related portions of the TANF program. We've been doing that since the inception of welfare reform, so we have many, many years of experience. Our average caseload is about 650 folks, and again, we've been working with Mathematica and other key partners for about 2 years to bring forward some of the practices that I will be sharing today. Next slide. So in Larimer County, LI2 really has been helpful to us and beneficial in three specific ways. One is a strategic planning workshop where we brought our coaches. That's how we refer to our case managers as coaches, and our customers together to do a strategic planning process regarding some new technology. We've also done a number of road tests. We did an entire series of road tests in 2 different areas to really get very specific about the learning and the innovating and the improving portions of the LI2 process. And those 2 road tests tied to our online platform that we've been working on for quite some time, and that ties to building in goal achievement strategies for our customers that they can access 24/7 and use at their as part of their plan, but then also as they need to move forward in their lives. And then we also did a rapid cycle evaluation, which is not as big as a random control trial, but it has a lot of the similar elements. We had control groups, and we were really trying to determine whether or not some messaging changes and behavioral economic strategies, if that would increase the return of our monthly contact sheets or our monthly timesheets. So we've really used the LI2 process in 3 very distinct ways in Larimer County. Next slide. As I mentioned in the strategic planning workshop, we have an online tool that we have been working with a private company on. It's called My Journey to Success. It is an accessible 24/7 mobile-friendly 2-way facing technology that basically takes 6 major life areas that we know are important to our customers, and we have populated it with pre-existing action steps to build in the goal achievement skills and to reduce our staff workload. And then customers can also build their own action steps in the platform. And basically what we are trying to do is to reduce the repetitiveness of information that our coaches have to share with our customers on a regular basis, and trying to be more time efficient so that when our coaches are working with our families, they are actually able to work on the goal setting and goal achievement strategies, as opposed to talking about some of the things that we need to talk about, like how do you get child care, how do you find some housing resources. Many of those things are very patterned. There are only certain resources that you can go to. There are steps, there are forms, and all of those pieces are now living in the online platform that our families can go to at any point to take a look at those resources. The interesting thing was when we did this strategic planning workshop, we had our coaches and we had some of our customers participate in it, and it was a collaborative process with all of us together. And one of the key pieces our customers shared with us was that if this platform is not mobile friendly, I'm not going to use it. They were very clear about that, and based on their feedback, we immediately moved to creating a mobile-friendly version of the platform, because they were just very clear. So we saved ourselves, or they saved us, a ton of time and energy by helping us understand that. So the 6 major life areas that are held within the platform are listed on the slide. And then the Innovate workshop also identified ways to incorporate some of the insights from behavioral sciences regarding the successful use of goal-oriented skills. And so we have brought in a lot of experts to help us really follow the science on how people can increase the likelihood that they will set and achieve goals that are important to them. Next slide. So I mentioned earlier that we have done a ton of road tests. And one of the very first road tests we did was to talk about basic usability and functionality of our online platform. And again, we had a several different ways that our customers could give us feedback on what they liked and what they didn't like in the platform. Our coaches were also telling us what they liked and what they did not like. And that road test operated for 5 weeks from June until August of last summer, or 2016. And again, I think one of the values that I see in the road test process is that instead of us rolling out the online platform for all coaches, for all staff, for everyone to use all the time right away, we really just asked for early adopters in both of our customers and with our staff to say, we need you to test this, we need you to be honest with us, we need to make this the best it can be, and we are going to confine that experience to a certain time frame, and we are going to ask very specific questions, and we are going to provide very specific methods in which you can share your feedback with us. And it has been really very helpful, and it also really has helped staff manage the change fatigue, as opposed to rolling something out big and then finding out it didn't work exactly the way we wanted it to and then having to redo it. Our road test 2 was looking at, again, so we got the feedback from road test 1 about our online platform. We made some changes, we made some enhancements, we made some of the improvements that they had requested. And then we rolled it out to really test whether or how coaches were using the online platform during their in-person meetings. Were our customers using it outside of the office? And if so, when were they using it? And in what ways was the platform helping reduce the administrative responsibilities of the staff? And basically, was it helping customers get access to services and supports when we were not in the office? We're here 8 to 5, Monday through Friday, but life happens 24/7. And our goal is to have the platform be a resource for our families when we are not physically available to help them. We tested that road test for 6 weeks in January through February of 2017. And then the third road test on the online platform talked about we moved our monthly reporting document, which we now call the monthly timesheet. We moved that onto the online platform so that our families could report their work activities using their phone, using their computer, using any kind of public access they had for technology. And we really wanted to test whether or not the functionality for the monthly timesheet made it easier for customers to submit their required monthly timesheet in a timely manner. We have ongoing historical struggles getting that form turned in timely with the right verification and documentation of the work activities. So we really wanted to know if we're offering it online and they can do it on their phones and they can do it on the computer, will it be turned in more timely, and will it make a difference in terms of us having to do less work to track it down? The other part is, does it reduce the staff burden of trying to manage this administrative responsibility? We also initiated a random drawing and an incentive for a Kindle and 5 prepaid credit cards to entice customers to do it online, give us their feedback, and to complete the survey so that we would understand their experience and understand what changes we would need to make. As a result of the road test regarding the monthly timesheet, again, our caseload's about 650 individuals per month. We had 381 customers initiate an online monthly timesheet in that first month, and 327 customers successfully completed it. So that was one of our first learnings, was to inquire as to those who initiated what was happening that it was not completed and successfully submitted. Of the 327 folks who did it online, we had 123 customers provide 153 responses to surveys, which we were very excited about. Of those who responded to the surveys, 67% reported that the online monthly timesheet was easier to use, 9% reported it was harder, 70% reported that the online monthly timesheet would make them more likely to complete and submit it on time. It took a couple of months, but we're actually starting to see that that may be coming to fruition. We're not quite there yet, but we're actually seeing some real positive gains in that domain. And then in 1 month's time, 60% of the caseload transitioned from a paper monthly contact or monthly timesheet to an online. And we did that within 4 weeks in the month. We also did a variety, we have continued the road test philosophy within our TANF program. And now as we begin to roll out other changes, our staff, our coaches are actually writing out the plan for the road test, getting very clear about the purpose of the road test, very clear about the questions that we're looking to have answered, and the methodologies by which we will actually do that. We are flying solo on our road test number 4. Thanks, Mathematica. It has been wonderful. We also did a whole series of road tests on WOOP. Michelle's talked about that, and I'll just tell you that the road tests were very enlightening to us in terms of our staff feedback, but also our customer feedback. Next slide. So what I would say is that on the rapid cycle evaluation, that was our ability to begin to tap into more, I would say, defined research methods. We really looked at whether or not changing the messaging and the approach of getting folks to turn in their monthly timesheets was improved by different messaging and different strategies. We actually had 3 different groups that were receiving different interventions, and everything from doing work just the way we always have to different messaging and the use of incentives. And interestingly enough, what we found was that really the different messaging and the different or the use of incentives really didn't change our return rate. The online monthly timesheet, though, now that we've moved to that, does seem to be making some headway in that domain. Basically, I would say as a result of LI2, Larimer County has become more analytic in planning program changes and using research methods to improve implementation and program outcomes. I would tell you that it's starting to spread throughout the agency, and other teams, because we have the Workforce Innovation and the our Opportunity Act, we have a variety of different programs, and it's really starting to infiltrate how we look at work and program changes throughout the agency, and it's been very positive and very well received. And mostly, you have to have your staff along for the ride, and I think doing the road tests in particular really helps them manage all the changes and allows them to move forward in a more unified manner when we're clear that what we want to do is working and it's achieving what we're hoping to achieve. So with that, I thank you very much for your time, and I'll turn it over to Noelle Simmons with San Francisco.
Okay, thank you, Dina. Good afternoon, everyone. My name is Noelle Simmons. I'm a Deputy Director at the San Francisco Human Services Agency, and I'm going to be talking as well today about how we've used the LI2 process to help improve outcomes in our TANF program. Next slide, please. By way of brief background, I wanted to mention that TANF programs in California are county administered as opposed to state administered. So my agency is the County Public Social Services Agency in San Francisco. We administer TANF and the other major entitlement programs, and we currently have a TANF caseload of about 3,300 cases. In addition to the benefits programs, we also have a local initiative called Project 500. P500 seeks to disrupt the transmission of intergenerational poverty while improving outcomes for both parents and children. All of our P500 clients are also TANF clients when they enter the program. But in addition to the usual suite of TANF services, our P500 clients are each assigned to a mentor. And the role of the mentor is partly to provide an additional layer of case management support, but really primarily to help the clients identify and achieve meaningful goals that they set for themselves and their families. And our staff are working with clients on goal setting across a number of different domains, such as employment, education, housing, or health. P500 is a recipient of technical assistance under Project Improve, and we've been working with a team from Mathematica for about 6 months or so. Next slide, please. So how are we using the LI2 process in P500? We are testing a package of tools that are intended to help low-income families set meaningful near-term goals for themselves, to come up with a specific plan to accomplish them, to anticipate and plan for potential challenges that might get in their way, and then to reflect on their experience. We use the LI2 process with 7 of our Project 500 mentors, as well as their supervisor, and then with a variety of our P500 clients. Next slide, please. This is just a quick visual on 2 of the tools that we road tested. The tool on the left is My Goal Plan. You heard Michelle speak about this a little bit earlier. This is a tool that helps clients set a goal, plan for how they're going to accomplish it, and then after the fact, review and revise their goal. On the right is our Potholes and Detours tool, and this is the one where clients are spending time before embarking off on a goal to think about what potholes might get in their way and what strategies do they have to overcome those challenges as they arrive, and really plan that out in advance. Let's go to the next slide. So we've structured our LI2 process in San Francisco around a 2-phased road test. Phase 1 lasted for 6 weeks, and during that phase, we asked our staff to use the tools at least 3 times a week, and then we asked them to respond to a weekly survey about their experience using the tools. We then took a 2-week break, and during that time, Mathematica took all the data that had been gathered from phase 1 and synthesized it, analyzed it, and brought it back to me and my managers, where we discussed the findings, made some adjustments and revisions to our tools based on the findings, and then planned for the phase 2 of the road test. We actually ended up revising the road test process itself for phase 2. We decided that rather than a 6-week road test, we would condense the experience into a 2-week intensive boot camp. And during those 2 weeks, we required our staff to make daily use of the tools. They were asked to use at least 1 tool with every client they encountered. And then staff were asked to report their feedback in 2 ways. They still completed a brief daily survey, but they were also brought together in person as a group, the 7 mentors with their supervisor, to debrief in person on a daily basis about their experience. And the staff actually really liked that model, which I'll talk a bit more about in just a minute. To the slide that's in front of you, we had 5 learning objectives for our road tests. First, we wanted to understand the experience of staff in using the goal achievement tools. Secondly, we wanted to understand how the staff perceived parents' reactions to using the tools. Third, we wanted to learn what types of goals our clients would use the tools to set. Fourth, we wanted to better understand the strengths and limitations of the goal achievement process. And finally, we wanted to surface any recommendations that our staff might have for revising the goal achievement tools and process of using them. Next slide, please. Okay, so unlike Larimer County, who's 2 years into working with the LI2 process, we are only 6 months in. Just this week, we are wrapping up our phase 2 road test. So we don't yet have the final analysis on all of this to share with you today because we're still midstream. Having said that, my last 3 slides here do attempt to compile just some thoughts around what I view as sort of the opportunity or the value in the LI2 process, the challenges, and then I'll wrap up with some lessons learned and considerations for others who might be thinking about using this process. So first, the opportunity. Through Project Improve, we are receiving free technical assistance from an extremely knowledgeable group of TA providers. So that in itself is pretty amazing. When Michelle invited San Francisco to participate in Project Improve, I kept thinking, well, what's the catch? Are you really going to come out here and spend all of this customized individual time with us, and we don't have to pay you or anything? And we didn't. So it's been really, really amazing. I would say that what we're bringing to the table is really active participation in the technical assistance. This is not sit back and let a team come in to do this for you, but we've had to be really actively engaged in an ongoing back and forth with the Mathematica team. Secondly, I think that the structured and time-limited LI2 process really accelerates your learning, particularly if you are implementing a new program as we were in San Francisco. As I mentioned, our road test stretched over a 10-week period, and during that time, we really quickly surfaced some of the pain points in our process, and were forced to clarify how it really was that we wanted to use these tools and how we were expecting staff to integrate them into their daily work. One thing that's great about the LI2 process is that the process is built to capture feedback on a daily basis and report it back to you. So a lot of times in the busy rush to implement, we don't take the time to step back and say, well, how is this really going? Is it working as we expected? And that process of gathering feedback and reflecting on it is built into the LI2 process, which is great. Examples of learnings, I think in the condensed time period, you learn to fail fast and forward. So for example, we learned that some of the worksheet-based tools we had developed posed challenges for the small handful of our clients who are completely illiterate, because obviously they couldn't fill out the worksheets for themselves, and even if our staff filled them out, the clients couldn't take them home and read them. So that sounds sort of obvious, but we didn't really have that aha until we were in the road test process. The third bullet on this slide captures worker and client experience. I talked about that a little bit. Again, when we're busy, I think all too often we roll out tools or procedures or training to staff without getting their input. That feedback loop is built in here. And then finally, it creates an opportunity for peer-to-peer learning, troubleshooting, and identification of what works best. I mentioned the boot camp approach that we used during our phase 2 road test. Our staff really, really enjoyed the opportunity to come together for just 30 minutes every day with their peers in an informal setting and be able to say, hey, I tested this tool and it really didn't go that well. This is what I encountered. And then have a colleague say, oh, well, I used it in a slightly different way and it went really well. Maybe you could try it that way next time. So it was a lot of value packed into a 30-minute daily debrief. Next slide, please. This slide speaks to the challenges of the process. First of all, direct service staff may be unaccustomed to the innovation process, or they may not view it as really being their role. We were road testing with a group of social workers. They think of their job as being about direct client interaction. And for some of them, the shift to a program design lens was a little bit unfamiliar or outside of their comfort zone. So some staff like the opportunity to provide feedback on the tools, and others struggled with that a bit. There were also competing priorities for staff time. We were encouraging the staff during the phase 1 road test to use the tools, but we were observing that when the staff were sitting down with clients and the client was presenting with a crisis, the LI2 process sort of took a back seat to working to resolve the client's problem. And that's to be expected, of course, to some extent. We did end up requiring participation during the round 2 road test. And then finally, I just want to note that LI2 does help to improve your service delivery process, and it provides insight into client and worker experience, but it's not an outcome evaluation. In other words, LI2 won't tell you whether your service intervention actually works, but it does give you real-time indicators of why something may or may not work, and it points you in the direction of what changes you may need to make. Next slide. Final slide for me. So a few lessons learned. To state the obvious, you should be really clear about what you're trying to learn as you go into this process. The feedback mechanism is brief, and so you want to get the most that you can out of, a few quick feedback questions. Secondly, I would recommend that you consider using the LI2 process during the formative stage of a new program or process. In some ways, it's better to innovate and improve early on because staff aren't yet attached to a particular way of doing something, and so it makes the change process a little bit easier. Third, set expectations with staff. Make sure you clarify their role and consider requiring their participation. I already spoke to that. In short, the learnings from the LI2 process are only as good as the feedback you get. So I think it's worth carving a little time out of your staff day in order for them to participate and provide that feedback. The fifth bullet here, consider a facilitation guide for the supervisors who work with participating staff. So in the boot camp model, we had the staff supervisor leading the daily conversations. In retrospect, we thought it might have been helpful to give her a structured set of questions to guide the conversation productively. The broader takeaway here is just you want staff at all different levels participating in the LI2 process, and you need to be thoughtful about how you're setting up different staff for success. And then my final comment is just that a successful LI2 process could affirm the direction that you're headed in, or it could require you to pivot. And so you really have to go into the process with an attitude of flexibility and openness to change. So I'm going to go ahead and stop there.
I totally appreciate. I'm sitting there taking notes as you're talking, Noelle. From your, this is part of the iterative process of how we refine how we work together, both researchers and practitioners, to get to this level of granularity about what's working, what's not, both about the LI2 process and about the intervention itself. So appreciate both Dina and Noelle for your comments. We want to open it up to questions and see if there's immediate questions for Dina or Noelle. And if not, you're going to have to listen to my reflections. So let's kick it over and see. Scott, do you have any questions that people have had for them? And go ahead and type it into your question box. I guess that's the best guidance. Okay. Katie, the millennial, is nodding to me saying, yes, that is the guidance. So.
Yeah, if you have any questions, there's a Q&A widget on the tray at the bottom of your screen that you can use to type them in, and we've been getting some questions in all along. So I think I'll direct the first question to Dina, and it's a bit of a two-parter. But somebody wanted to know first where the funding came from, the incentives to fill out the online application, and just a little bit more about what the timesheet system was, and how did you manage some of the confidentiality and data security issues in doing the timesheet and then in doing the road test as well.
Okay, so we paid for the incentives out of TANF, our TANF funding. The Kindle actually was donated to us from a local employer. It was, I think it's a car repair location. They donated like 15 Kindles for our families, so we used one of those. In terms of the security, the platform that we're using actually is active in the university space, and it's active in the university career counseling space, and so we saw a demo of it and saw that not only could it help us with our job search functions and career exploration aspects of our programming, but that the infrastructure of the platform actually could help us do some other pieces. And so we've been working with this company to build out these additional pieces. They have fronted some of the funding themselves. They are a private business. They do hope to, at some point, perhaps market it to other similar entities. We have funded specific applications in there that really will only apply to our use and maybe don't have any broad opinion or appeal to a broader audience. And that's where the monthly timesheet piece has come, is we have worked on that with them, and it has been very interesting and very eye-opening in terms of the technological savvy that many of our families have, and their willingness to meet their requirements when we have provided them a method to do that. That's a lot easier for them.
Thanks. This question, the next question is, I think, both for Dina and Noel. But both of you talked a bit about getting input from frontline staff. Dina, you mentioned, a little bit about change fatigue. Could you, both of you, talk a little bit about getting buy-in and investment from frontline staff, and in particular, in preparing for the process? How much lead time did it take to prepare staff for their part in LI2?
So this is Noel. I can jump in and respond to that first. I would say that initially the prep time was sort of behind the scenes, where, I and my sort of manager and supervisor in Project 500 had numerous conversations with the Mathematica team, thinking about how we wanted to roll this out and being very thoughtful about that. Michelle mentioned at the beginning that we kind of initiated this whole process with a 2-day strategic planning retreat, and we engaged both executive level managers and direct line staff in that 2-day retreat. So they got a really solid preparation and introduction to the LI2 process at that 2-day retreat. And then as we got closer to actually implementing the road test, the Mathematica folks put together a training webinar that all of our staff were able to tune into and get an overview of the process and what would be expected of them. And then from that webinar, I think the following week, we really just dove right in. So I guess I would say there was a lot of thought, but we didn't use a lot of our staff time in the lead up. We gave them as much information as they needed, and then we just set them to it. During the road test phase itself, there's a lot of opportunity for back and forth with staff, opportunities for them to provide feedback through surveys, through office hours with the Mathematica staff, and through the team debrief meetings with their supervisor.
And I would say in Larimer County, the team has been involved in the process all along. I think when we first started doing the road tests, we were not familiar with the process, and we weren't familiar with the language. We weren't familiar with how it really would happen, and we were not as familiar with the benefits that could come from it. And as we've been doing it more and more, it's just now part of the culture of our conversations. It's like, well, if we're going to do this, should we do a road test? Who's going to take the lead on the road test? What is the time frame for the road test? What are the questions? It's just become part of what we are doing, which I think has been really powerful. And so I would say that it has, for the individual road tests, the lead time has varied. I would tell you that we had one misfire where we thought, as in terms of administrators, we had allocated enough lead time, and the team was very clear with us that there was not. So, you have to have that adjustment. But, yeah, it really has varied, but it's just gotten faster the more and more we've gotten comfortable with it.
I want to chime in on this because, Dina, you were at this meeting, but I remember the first time I trained the Larimer County staff on road tests. It was like everybody was just fear and trepidation the entire time. And so I actually just slowed down and just said, what does this mean for you when we talk about research and evaluation? And we just had a conversation about what comes up for you, and they said fear, math, all these things. But by the end of that conversation, they were like, we can do this. And it felt really accessible to the staff. And now in Larimer County, they ask us, when we've come out, when are we going to road test this? And they ask you guys as well, Dina, is when are we going to road test? Are we going to road test this? There's this notion of it's going to reduce our staff and our time, and we're going to figure out how to get it to work and use this process for it. The feedback we've had there and in other sites is we've never felt so included in a change process. And so it is, where it is a little bit newer for P500, but in some of the other sites, there's an adjustment to it, but once they adjust into it, as Dina said, it becomes part of their culture. But initially, there may be some fear, and you just have to kind of ease their fears and say, this is just about providing feedback about what's working and what's not for you. You guys are the experts.
So this is a question for Noel, but I think we can open it to Michelle and Dina as well. You know, when you talk about changing the road test, the way that the road test is run and going to this boot camp idea, in terms of setting up the road test, how do you know the correct number of iterative cycles to run and how long? Because it seems like some of them varied.
Right. So I'll take a stab at answering that, and then Michelle may want to chime in as well. This was our first, go with the road test process in San Francisco. So for the initial design of phase 1, we were really kind of looking to Mathematica to provide some guidance based on their experience in other places about how to structure the road test and the duration of the road test and so forth. So that first phase ran for 6 weeks, and I think I mentioned, we asked staff to use the tools and respond to the survey, but we didn't explicitly say that they had to or that it was required. And so we did get good participation, but it was a little bit variable. Some staff were more engaged than others. And so for the second go-round in the debrief between the 2 phases, we were talking with Mathematica about that. And we talked about incentivizing the staff to participate or requiring the staff to participate in phase 2. And we actually did both of those things. But we also decided that if we were going to require more intensive participation, we would make it for a shorter period of time. So not 6 weeks, but just 2. And try to keep, the intent there was to really make everybody very intensely focused on utilization and adoption of the tools in a very condensed time period. And so I think that worked well. Michelle, do you want to reflect on that at all?
Yeah. This is one of those situations where Noelle trusted me on a gut instinct, and I so appreciated her for doing that. Let me answer the broader question of, we really followed initially what Harvard's translational science model recommended, was thinking about what is the time frame do you have available? So some of the decisions about the length of the learning cycles is, how much time do you have? What's your resources like? How many, do you need to have? There's a whole host of other things. I'm drawing a blank now, but there's these other kinds of things that you would just kind of consider from the outside. Where I knew we came back from P500. And it was good feedback, but again, we actually had a pretty okay response rate, but I thought, what happens if we put them in some ways, and I apologize for this language, but under a stress test? We throw them in and really, immerse them in this intervention. We've done a slower iteration, so they're kind of adjusted to it, but if we put it under to really figure out what's working and what's not. And that was, and again, Noelle trusted our judgment on that, and then gathered feedback more frequently and incorporated the supervisor, I wouldn't have done it had the supervisor not been as strong as she is as well, and had the supervisor take part in a collaborative way of really trying to help shape and provide that facilitation of those daily meetings. But I think the information that we're getting, we are getting that stress, kind of the glitches. But this is reality. This is, workers' reality is always working under stress. And so what we're getting is really good feedback and lots of things that we need to pay attention to and fix. And that's what you want, is to be able to fix the problems before you're saying everybody's doing this for everyone, where the cost of fixing it is much higher. So in some ways, that was a total calculated risk that Noelle and her team, given the strength of her team, I was willing to take that risk, but it really provided some rich feedback about what's working and what's not, and how her staff are adjusting under that that kind of stress test model. Again, I wouldn't do it with everybody, but it was the right time at the right and the right site, and it ended up giving us information that I'm going to share, with other communities as we start to roll out, more of those tools. But it's been hugely helpful for us in terms of the tool development, the process development, as well as I think for just the insight from the field. So anyway, I'll stop there on that.
It sounds like LI Square can be tailored to the each individual
Absolutely.
site in a lot of ways. Could you talk a little bit about that?
It has to be tailored, again, based on resources, based on timing, based on supervision. We think about, do they have good supervisors in place? Do they have good leadership in place? Do they have good staff who are willing to provide feedback? What's staff workload like? We want to prepare staff for that workload. Those are some of the things that when we're thinking about and figuring it out with the site, and it's in collaboration with the site. So both Noelle and Dina and their teams have provided feedback and support and insight into how to design that. Anyway, do you guys want to chime in on that?
No, I think you've done a great job, Michelle. I don't have anything to add specifically.
No, I agree, Michelle. You captured it.
Do the three of you want to talk a little bit about the commitment that LI Squared requires from the site?
I would love to hear from you guys what you see that.
Sure. So this is Noelle. Go ahead, Dina.
No, go ahead, Noelle. Go ahead.
Okay. I said in my remarks earlier that this is really an active sort of TA engagement. This is not sit back and have a team come in and do it for you. So part of, there's a lot of benefit to the condensed process, but part of the challenge is you're getting feedback in real time. Your staff have to be able to engage in the process. You have to carve out the time for them to do that and make it a priority for them to do that and to fit that into their already busy days. And then from management, there's also, a demand that you be available to sit down, at the end of road test 1, hear the feedback, engage with the Mathematica team, really try to hear the feedback that staff were providing and think about what does that mean for how you have to change your process or change your tools. So it's a very active collaboration. And as Michelle said, we've learned a lot, and I'm really looking forward to getting the learnings from our Phase 2 road test. I think there are going to be things that we're going to sort of have just a running list of, here are all the issues that came up for us during the road test and things that we know we need to modify or fix or improve on. And we're going to have our work cut out for us in the coming weeks after the road test itself is over.
Yep.
I would agree with everything. Yeah, I would agree with everything that Noelle shared. The other part that I would add is it actually, I think, improved our program in a different and unintended way, because in order to create the capacity for the staff to be able to do their part in this adventure, we had to get really clear about what things were critical for us to be doing and what things were we doing that really weren't critical and actually could go away. And that created a lot of really good conversation and I think has led to other improvements in the program just as a byproduct of we can't do it all the way we've been doing it. We must do it differently, and getting real clear about what are the essential functions of our work and what have we adopted or brought in as baggage from years past because we have been doing it that way. I would just say that it's also a lot of fun, because I think one of the reasons the road test has become part of our culture is that we are eager to hear what we think about it. We're eager to hear what our customers think about it. I also think we're passionate and committed to creating the best products we can for our customers, and I think that that's a fuel that just pushes us forward, and this whole process has really supported that.
Yeah. I think the only thing I would add to that, and I think that this is the strength of both of you as well as your management teams, is you have to have thick skin in this process, because I always, in research, if you don't want to know the answers, don't ask the questions. And these guys are willing to ask the hard questions to get at, something's not working. There are elements of all of this that doesn't work, and that's the whole point of the process. Is to say, how do we uncover these and address them before we fully committed, when it's really small and we're not fully there. So this is a period of time where we're really innovating and iterating and really getting it right up front. That may be a little bit more labor intensive, but the goal is that you're going to save the headache and the heartburn and the time and the frustration down the road if you get it right before you scale it up and roll it out, permanently. So that, that's why, that boot camp is 10 days, and that's it. Then we'll stop and we'll reassess and we'll figure out what to do differently. But that there are these contained periods of time that are more intensive, but will save time in the long run. That's the hope, anyway.
So I think we have one more question from the listeners. And it's just a more general question about LI2. I think would it be correct to look at LI2 as a next generation of rapid process improvement, and perhaps, with more of an addition of the scientific method? And I think this question is for Michelle.
Read it again.
Sure. So would it be correct to look at LI2 as the next generation of rapid process improvement?
Yeah. Definitely. We use different language in LI2, and this was a part of building LI2 was going to the field and figuring out the right language that worked and resonated for people. So I would say research methods and the scientific method is really baked into the process, but looks a little bit, the language we're using is a little bit different. But I do see it, the benefits of LI2 is, I'm an implementation researcher. This is about, first and foremost, getting the right intervention or right, right strategy for trying to achieve the outcomes that you're trying to achieve. But it's also about getting a good implementation, making sure that it's well integrated into the program. And so there's two kind of benefits along those lines. One of the other unintended consequences, which was very positive, was that we found that and this is a little bit of a tangent, but in doing the road test process, that we reinforced training. So in some ways, in other programs, what happens is you do a training and then staff go back to their work and they get stressed and they revert back to what they know. But in doing the road test process, you're reinforcing what they learned through the training so that it sticks and they're answering questions on it every day or every week. And so it really does, in the words of the research world, ensures that you're working toward fidelity. And so I hope I answered the question correctly, but I would argue that, and I could explicitly sit down with somebody and say, here's all of the research methods all the way along that's baked into the process, an implementation study during the learn stage, data analysis in the learn stage, innovate stage, a roadmap for change is essentially a different form of logic model. Like all these, the innovate stage, this is that rapid formative feedback that then also prepares for more formal evaluation down the road. But you're still gathering information in that improve stage, and we very explicitly kept it improve instead of evaluate or added on another evaluation stage because we see it as this notion of how do we get it to work, not does it work, yes, no, but how do we keep refining and using analytic rapid cycle techniques to get it to work. And if it really, you can see it's not going to work, then you abandon. But it's not this kind of, traditional, okay, we've studied it, does it work, yes, no. It is, how do we get it there? So anyway, that was a long-winded answer. Noel, Dina, do you have any other last parting words? I know we're just about out of time.
Not from me. I would just encourage folks to think about testing this type of thing in your own workplace. I think there's a huge value to it. Thanks, Michelle.
I would add the same piece, and I would say that it has been extremely invigorating. I've been doing this work for several decades, and it's been very invigorating. So while there may be some nervousness or hesitancy at the very beginning among staff, I think it's easy to bring them along, and it's easy to build that momentum and just kind of re-energize the entire program and really do the best we can for our families that are on TANF.
Great. Thank you both so much, and thanks to OFA for sponsoring this webinar. And if you have any questions, we are available through Project Improve. We want to share this LI2 process, so contact me or Scott Baumgartner or both of us, and just let us know if there's an interest in learning more about LI2, if there's an interest, you've got a program change you want to possibly be considered under Project Improve, give us a call and we can talk that through with you. Our emails are on this website right now. So thank you. Anything else, Carol? All right, I'll take that as a no since we're 1 minute over. All right, thank you.
Yes, thank you, and there's a short survey that will launch when the webinar is done, so please take a moment to fill that out. We use that information to make our webinars better, so thanks very much.